You should be home within 24 hours after your pile surgery. Pain is expected as there is inflammation. In the first couple of days, pain may be on the higher side, but it typically comes under control with medications. It should not be unbearable. Now, the most important doubt you may be having is what pooping is going to feel like. Let's have a look at the various aspects. There's a chance that you may not pass stools for a day or two because your colon is completely cleared before surgery and there's very little you eat on the day of the procedure. You may also have bloating for 2 to 3 days, especially if you've been resting in bed for too long. This should come down with a little bit of movement like walking around. Post-surgery, you may have an increase in the frequency of bowel movement as compared to your normal pattern. This is because the muscles in the area are under the effect of anesthesia and are relaxed. You may also have urgency, which is an immediate need to rush to the toilet. Sometimes you may have a false sensation of urge to defecate. Try to ignore this urge by distracting your mind with reading, watching television, or working. Do continue Kegels exercises and you will notice that slowly everything returns to normal. Don't force or exert yourself to poop. Wait for the pressure to build up. Use anal spray a couple of minutes before you pass stools. Now, while passing stools, don't be anxious and don't tighten your muscles. Stay calm, take deep breaths and allow the motions to pass. Once you're done, wash yourself with water from a regular hand faucet. You can follow this up with a Sitz bath. It's not mandatory, but it's very soothing. Now, after you're done, pat yourself dry and apply anal spray once again. You may experience itching and burning in the region. These symptoms are a part of the healing process and will subside as days pass. In the first 3 weeks, you may notice a few drops of blood while passing stools. This is okay. However, if the bleeding is more, please contact us anytime 24/7. You may notice a small wound externally if you had a skin tag that was removed during surgery. Sometimes due to friction, stool particles get stuck in this wound and cause burning. So just keep it clean with water. If you feel constipated during the recovery period, take our plant-based laxative Constack. The dose ranges from half a spoon to 2 spoons depending upon the kind of bowel movement you're having. The internal healing after a pile surgery usually takes about 3 to 4 weeks. If skin tag excision was done, the external wound will heal in 5 to 6 weeks. We recommend you get back to your day-to-day activities within 3 to 4 days. This would include cooking, going to the office, running errands, or doing light exercise. Well, this is all you need to know. If at any point you feel something is off, please feel free to reach out to us anytime 24/7. We wish you a smooth recovery.